know that practicing ostomy care routines can help maintain healthy skin around the stoma. For example, it is important to establish healthy skin cleaning habits. Skin barriers adhere best to clean, dry skin. Soaps and cleaners are generally not recommended, as they may leave a residue on the skin that can interfere with the adherence of the skin barrier. It is also important to keep an eye on the condition of your skin. Assess it regularly during pouching changes, looking for signs of rash, redness, or irritation. Remember, skin irritation is not normal. If you discover red, broken, or moist skin around your stoma, seek the assistance of a nurse who specializes in ostomy care. Leakage is one of the main causes of skin irritation, and one way to help prevent this is to ensure the skin barrier of your pouching system fits securely around your stoma. Measure your stoma with a stoma measuring guide to ensure the skin barrier fits where the skin and stoma meet, and fill in any gaps, creases, or folds with ostomy accessories if needed.